is Jennifer Guevara, social network.
Definition: bleeding in early pregnancy is strongly associated with pregnancy loss. Miscarriage can cause excessive bleeding, infection, and complications associated with surgical treatment, as well as substantial psychological harm, including anxiety.
If you are having trouble getting pregnant, staying pregnant, have long or irregular menstrual cycles, or were diagnosed with polycystic ovary syndrome, PCOS, you could be suffering from a progesterone deficiency. The following are 4 signs of low progesterone. 1. Spotting 1 or more days before your full period begins. 2. A short luteal phase, which is defined as less than 10 days between ovulation and the start of your next period. 3. Adult acne, brittle nails, or dry, cracking skin. 4. Lack of energy, low sex drive, and mood swings. If you are having trouble conceiving or have suffered from a miscarriage, you should check to see if your progesterone levels are low. Your doctor can order a progesterone test, or you can test your progesterone levels at home using urine progesterone test strips.
Application and
Progesterone is produced by the corpus luteum in the ovary. It is necessary to prepare the endometrium for implantation of the embryo. Additionally, progesterone is produced when an embryo implants in the endometrium and during early placental development. Progesterone is essential for the maintenance of the pregnancy. Several small
Bleeding in the first trimester is a common concern of many women, and may I reassure you that most of these are of no real problem to you. The main reason that you can bleed in the first trimester is something called breakthrough bleeding. Now this occurs at the same time as your menstrual cycle will occur, and it compensates, carries on like little dust spotting until the hormone levels reach a certain level when it will subside. The second type of bleed is an implantation bleed, which is when the fertilized egg embeds into the side of the womb. And this just occurs one-off, and it's like slight spotting, but obviously of a concern to you. The third other type that's not really of anything to worry about is something called a cervical erosion. You might not even know you have this, but because the pregnancy hormones are at such a level that they cause the cervix to soften, during intercourse you might find you have this spotting. If you have any type of bleeding and you are obviously concerned, go along to your early pregnancy unit. There they can do blood tests and urine tests to check the pregnancy hormone levels. They will also do an ultrasound scan, and they can check for the fetal heart. This will help to reassure you that the other more serious concerns, such as an ectopic pregnancy or a threatened miscarriage, aren't going to happen.
I have suggested progesterone prevents miscarriage in asymptomatic women who have a history of recurrent miscarriage. Progesterone rescue a pregnancy in women who have started to bleed during early pregnancy. Cons: treatment with progesterone didn't result in significant improvement in the incidence of the live birth among women with vaginal bleeding.
Doctor, many women assume they'll feel the common symptoms during pregnancy like nausea, fatigue, but bleeding. What about bleeding? Because that's also a common symptom. What does it necessarily mean?
So bleeding is, of course, scary, and it's usually not normal during pregnancy. During the first trimester, the only bleeding you should expect or see would be implantation bleeding.
Okay.
And that is usually 1 to 2 days of spotting, which means maybe 1 tampon a day, 1 pad a day for 1 to 2 days.
Okay.
And that's it.
But some women don't even experience bleeding during pregnancy.
Correct.
So it's not always a telltale.
Right. It's not always a telltale sign. Only 15 to 25% of women experience that.
Okay.
And then that's it.
Now, when is the time for you to go to see your doctor if it's looking a little unusual?
If you're bleeding more than 1 pad.
Applying Ecuador, it is necessary to continue evaluating this pharmacological treatment implemented in Ecuador because there is no evidence to support the indication routine of a progesterone in prevention of miscarriage in the first half of pregnancy. However, there seems to be evidence of benefit in women with a history of recurrent miscarriage.
Dr. Carolyn McLean, a board-certified emergency room physician. You visited the urgency room today because you experienced bleeding during your early pregnancy. Early pregnancy is considered the first 6 weeks after conception. Bleeding in early pregnancy can be a sign of a miscarriage or an abnormal pregnancy, but spotting isn't always a cause for concern. Often the pregnancy will continue normally with no problems at all. During the examination, your urgency room healthcare provider may have asked for a blood pregnancy test and an ultrasound to try to determine the cause of the bleeding. Sometimes your doctor can't tell what the problem is right away and will need to watch you over time. You may need more blood tests and another ultrasound. If your healthcare provider was not able to see a pregnancy, it may be that everything is normal and it's just too early to see the pregnancy. However, early bleeding could also mean you have an ectopic.
Conclusion. Before prescribing progesterone, it is essential to have established the correct diagnosis and based on this, indicate the correct treatment for each patient. To sum up, progesterone is indicated in women with a history of recurrent.
First of all, I want to express my sympathies to you and tell you I am so sorry for the recent loss of your baby girl. My heart goes out to you and your family during this time, and I hope the best for you in the future. Now, you mentioned that you were getting progesterone supplements until about 15 weeks. You started spotting at 17 and then delivered your baby girl at 19 weeks. And you're wondering if you were still taking progesterone, if you could still be pregnant. Of course, I don't know the answer to that for sure, but there are studies that show that progesterone can prolong pregnancy and help a woman to stay pregnant longer, and it's often prescribed to women who have a history of preterm labor or birth. So next time you get pregnant, I recommend seeing a doctor. Let them know about your whole history, everything that happened last time and in situations before that. And chances are, because of your strong history of preterm labor and delivery, they will probably recommend progesterone. I sincerely hope the very best for you in the future, and if you have any more questions in the future, please don't ever hesitate to ask.